Some positive signs on the hospital front. COVID-19 hospitalizations, while still very high, are headed in the right direction and for now appear to have peaked. ABC 15's Mike Pelton looking into whether the improving data matches what doctors are seeing.
Well, according to our state's coronavirus dashboard, the number of COVID patients who need a bed in Arizona hospitals is now at its lowest point since mid-December. But today, a doctor I talked to says we're not close to a celebration.
There's still multiple COVID units in all of our hospitals. They're still very much in need. There's still ICUs filled with COVID patients on ventilators.
Dr. Matthew Hines is a hospital physician in Tucson, as well as a member of the Pima County Board of Supervisors, and tells me he has noticed some relief working the front line.
It's not a massive shift, and that's why I want to make sure people understand that the hospitals are still, okay, maybe they're not filled to beyond capacity in the most crisis of modes, but we're still flirting with capacity.
Indeed, data from the state shows more than 3,600 COVID patients in Arizona still need a hospital bed, but that number is trending lower. One of the most blunt analysts of our state's COVID crisis, University of Arizona Associate Professor Dr. Joe Gerald, writing in his latest modeling report, quote, "This week saw another meaningful decline in COVID-19 cases, which now clearly represents a sustained real decrease in viral transmission. This decline is accompanied by reductions in hospital and ICU occupancy. Reductions in mortality should quickly follow. While this reprieve is welcomed, the absolute level of virus transmission remains exceptionally high."
It depends on the night, but I'd say, 2 or 3 codes every night.
Dr. Hines noting the many deaths, which lag spikes in COVID cases by weeks. Dr. Gerald, in his weekly report, pointing out the state is seeing more than 800 COVID deaths a week, a mark never hit during last summer's surge.
It's a terrible, terrible thing to see folks that, typically we would be able to save die.
So while heading the right direction, Dr. Hines says one of his biggest concerns are these emerging variants and mutations of the coronavirus and just how big of a role they'll play in Arizona's COVID story. In Phoenix tonight, Mike Pelton, ABC 15, Arizona.